Welcome back, everyone, to another deep dive. This time we're focusing on something pretty unique, haematomyelia in cats and dogs.
And specifically, two cases involving surgical treatment and the outcomes.
Yeah, and what's really fascinating about these cases is that both of these animals experienced these hematomas after trauma after falls.
Exactly. It's not every day that we get to see the surgical management of haematomyelia, let alone in two different species.
Yeah, it's a pretty rare condition. For those just joining us for the first time, haematomyelia is basically when you have bleeding within the spinal cord itself, leads to this hematoma formation.
Exactly. And that can obviously cause all sorts of problems, depending on, the location, the size of the hematoma.
So let's jump right into the cases. The first one involves a 10-year-old pug.
Yep, a little guy.
What happened?
So this pug fell from arm height.
Oh.
Which, might not sound like a long way.
Right.
But for a small breed dog like a pug, it can be enough to cause some pretty serious trauma.
Yeah, especially when you consider how they're built, those short little legs and that.
Exactly. And unfortunately, this little guy presented with acute progressive paraplegia.
Oh, no.
And was also incontinent of both urine and feces.
So clearly a really, really serious neurological issue. What did the initial exam show?
So on exam, they found that he had a painful myelopathy, and that was localized to the L4 to S3 region of his spine.
Okay.
And even more concerning was that he had absent deep pain perception in his right pelvic limb and his tail.
So, that's a pretty significant finding. Right?
Absolutely. It suggests a severe spinal cord injury.
So then how did they ultimately pinpoint what was going on?
So they did an MRI, and the MRI showed an intramedullary mass, and that extended from the mid L5 to the cranial aspect of L6.
Okay.
And based on how it looked on MRI, they were pretty suspicious that it was either a hemorrhage or a hematoma.
Okay, so they had a good idea from that imaging. What happened next?
So based on the severity of his symptoms and the MRI findings, they decided to go in surgically.
Wow, that's a big decision.
It is. It is. But given how severe his deficits were, they felt like surgery was the best option.
So what did the surgery entail?
So they did a right-sided hemilaminectomy to access the spinal cord, and then a durotomy to open up the durotor, and then a myelotomy to actually get to the mass itself.
So multiple steps just to get to this point. What did the mass look like?
So they described it as being dark red and friable, and then they sent it off for histopathology, which confirmed that it was an acute to subacute hematoma.
Wow. So incredibly delicate procedure.
Yeah.
What was the recovery like for this little guy?
So his deep pain perception actually returned pretty quickly after surgery, almost immediately. And his spinal pain also resolved. And then he was actually able to walk again within 20 days of surgery.
That's remarkable.
It is. And then by 9 months, he was walking normally, which is just incredible.
That's fantastic. A really, really good outcome. Now, you mentioned earlier that he was incontinent. Did that resolve as well?
Unfortunately not. He did remain incontinent. But the owner reported that he still had a good quality of life.
That's really all you can ask for at the end of the day.
Yeah, exactly. As long as they're comfortable and happy.
Exactly. Okay, so that's one successful case. Let's move on to our feline friend. Tell me about the cat.
Okay, so this was an 11-year-old domestic shorthair,
Right.
male neutered, and he also had a traumatic fall. He fell from a 1-meter table.
Oh, wow.
Yeah, quite a distance for a cat.
Definitely. How did he present?
So he presented with acute progressive paraparesis, and he was also having trouble urinating, so dysuria.
So weakness in the hind limbs and then difficulty urinating. Okay. Anything else stand out on his exam?
So on neuroexam, they found that he had an L4 to S3 myelopathy again.
Okay.
And sadly, he was paraplegic, so he had complete paralysis of his hind limbs, and his reflexes and muscle tone were decreased in his pelvic limbs.
Another tough case, it sounds like. Did he undergo a similar surgical approach to the pug?
Yes, very similar. And the MRI findings were actually pretty similar, too. He had an intramedullary lesion, but this one was predominantly on the right side over L5. So they did a right-sided hemilaminectomy and removed this dark red friable mass.
And did histopathology confirm it was a hematoma as well?
They did. They confirmed that it was a hemorrhage and acute hematoma.
Okay. So similar presentation, similar surgical approach. I'm really interested to hear how his recovery went.
Yeah.
Did he experience a similar turnaround?
His recovery was also really impressive. He regained his urinary continence within 2 weeks.
Wow.
And he was actually walking by 6 weeks.
That's incredible.
It is. Yeah, it's a really great outcome.
So it seems like surgery was a really good option in both of these cases.
Yeah.
Were there any lingering deficits like we saw with the pug's incontinence?
So at his 5-month follow-up, he did still have some paraparesis and ataxia, so some weakness and some incoordination.
Okay.
But his owner reported that he had a good quality of life. He was jumping on furniture, playing with toys, all that good stuff.
That's great to hear. So both the pug and the cat showed improvement after surgery, even with those initial severe neurodeficits. It definitely makes you think about the potential for these cases.
Absolutely. And I think these cases really highlight how surgery can be a viable option for some cases of haematomyelia.
It's not something we see a lot of in the literature, so it's really valuable to have these cases documented. That being said, I'm guessing that surgery isn't always the chosen path for managing haematomyelia.
Right. We also have the option of conservative management, which usually involves things like cage rest, pain management, and addressing any underlying medical conditions.
So more of a supportive care approach.
Yeah.
How do the outcomes compare between surgical and conservative management?
Well, that's kind of the million-dollar question, isn't it? The outcomes with conservative management are really variable. They can range from poor to good.
I see. So it really depends on the individual case.
Absolutely. And there are a lot of factors to consider, like the severity of the injury, the location and size of the hematoma, the patient's overall health, and of course, owner preferences and resources.
It's really about weighing the pros and cons of each approach and making the best decision for that individual patient.
Exactly.
Now, something that stood out to me in both of these cases was the mention of SEWAR.
Spinal cord injury without radiographic abnormality.
Yes, exactly. Can you explain what that means for our listeners who might not be familiar with the term?
Sure. So SEWAR is basically when you have all the clinical signs of a spinal cord injury, but your radiographs don't show any fractures or dislocations.
So essentially, the injury is invisible on those initial x-rays. That's fascinating.
It is. It's more common in younger animals because their bones are more flexible.
Okay, that makes sense. But how is it possible? How can there be damage to the spinal cord without any obvious bone involvement?
Well, it's thought that the force of the impact can cause like a shearing or stretching of the spinal cord, which can damage those delicate tissues even if the bones themselves stay intact.
So it's a bit of a hidden injury in a way. It really highlights the importance of doing a thorough neuro exam and considering advanced imaging.
Exactly. If you just rely on x-rays, you might miss these cases.
Well, this has been a fascinating deep dive so far. We've learned about 2 successful surgical cases of haematomyelia, the challenges of SEWAR, and the importance of considering both surgical and conservative management options.
Absolutely. A lot to think about.
Yeah, lots to think about. And there's a lot more to uncover. So I hope you'll join us for part 2 of our deep dive into haematomyelia, where we'll delve even deeper into the nuances of treatment.
Stay tuned. Welcome back to our deep dive into haematomyelia.
It's been really interesting to see how surgery can make such a difference for these animals, giving them a chance at a good quality of life.
Yeah, definitely. But, it's important to remember that not every case is going to have such a positive outcome.
Right, of course.
Yeah.
So what are some of the things that affect the prognosis in these cases?
Well, a lot of it comes down to the severity of that initial injury. How badly was the spinal cord damaged? A more severe injury is going to have a tougher time recovering.
Makes sense.
And then the location of the hematoma matters too. Is it in a really critical area of the spinal cord? And the size, how big is it? Those things play a role.
Okay, so location, size, what else?
The animal's overall health is a big factor. Do they have any other underlying conditions? How old are they? Even their breed can play a role.
So it's really a combination of things that determine the prognosis.
Exactly. It's not always a straightforward answer, which is why it's so important to carefully evaluate each patient.
Now, we were talking earlier about the need for more research in this area. What are some of the key questions that you think future studies should address?
Well, one of the big ones is the timing of surgery. In both of these cases, surgery was performed relatively soon after the injury. But is that always the best approach? Or would some patients benefit from waiting a little longer? We need more data to help guide those decisions.
Yeah, finding that right time to intervene. What else comes to mind?
I think exploring different surgical techniques is important. These cases focused on hemilaminectomy.
Right.
But there are other approaches that could be considered. So we need more studies to compare the different techniques and see what works best for different situations.
So lots more to learn.
Oh, always.
Yeah.
That's what keeps things interesting.
Speaking of interesting, what about advancements in imaging? We talked about how important MRI is for diagnosis. But could new imaging techniques help guide treatment decisions or even predict outcomes?
That's a great question. And it's something that researchers are actively working on. There are some advanced imaging techniques like functional MRI or diffusion tensor imaging.
Okay.
And these techniques could give us much more detailed information about the spinal cord injury. We might be able to actually see how extensive the damage is, or even identify areas that have the potential for recovery.
So using imaging to get a much clearer picture of what's happening inside the spinal cord.
Exactly. And that information could be really valuable for tailoring treatment plans and giving owners a more accurate prognosis.
We also talked about how the outcomes with conservative management can be really variable. Why is it so hard to predict how an animal will respond to a more conservative approach?
I think one of the biggest challenges is that the underlying cause of haematomyelia can be so different from case to case. Sometimes it's a straightforward traumatic event like a fall, but other times there might be a bleeding disorder or a vascular malformation that's contributing to the bleeding.
Oh, I see. Yes.
And so identifying that underlying cause can be really important for determining the best course of treatment. But it can also be tricky.
Right.
You might need to do a whole bunch of tests, blood work, advanced imaging, sometimes even genetic testing.
And I imagine that even when you know the cause, there's still a degree of unpredictability in how the spinal cord will heal.
Oh, absolutely. The spinal cord is a complex structure, and its ability to regenerate is limited.
Now, let's shift gears a bit and talk about the post-operative period for those patients who do undergo surgery. What are some of the key things to keep in mind to ensure a smooth recovery?
Post-operative care is so important for these guys. Pain management is crucial.
Sure.
We want to make sure they're comfortable and that pain isn't hindering their recovery. And then you have to monitor them closely for any signs of complications. Things like infection, bleeding, any worsening of their neurological signs.
But really keeping a close eye on them.
Yeah, vigilance is key. And then we want to start physical therapy and rehabilitation as soon as possible.
Yeah.
Things like passive range of motion exercises, helping them walk, even underwater treadmill therapy can be really helpful.
This is really a multifaceted approach.
Definitely. You're addressing both the physical and the neurological aspects of their recovery. And it often takes a whole team working together. The surgeon, the neurologist, the rehab therapist, and of course, the owner plays a huge role too.
It's really a team effort.
It is.
Well, we've covered so much ground already. The cases, the procedures, prognosis, research. What other aspects of haematomyelia do you think are important to touch upon?
One thing we haven't really talked about is the psychological impact of these cases. And I'm not just talking about the animals, but the owners too.
Right.
It can be really tough to deal with a sudden severe spinal cord injury. There's a lot of stress, a lot of emotion. And so supporting the owner through that process is really important, just as important as the medical care we provide to the animal.
It's about recognizing that human-animal bond and how these injuries can affect that.
Exactly. We have to remember that we're not just treating the animal, we're treating the family.
Well said. It's about taking a holistic approach. Now, I know we've only scratched the surface of this topic, but our time is winding down for this part. Is there anything else you'd like to leave our listeners with before we move on to the final part of our deep dive?
Just that there's so much happening in the field of veterinary neurology. We're making incredible strides, and I'm really excited about what the future holds for treating haematomyelia. So stay tuned for the final part where we'll delve into some of those advancements.
And we're back for the final part of our deep dive into haematomyelia. We've talked about the challenges and the successes, but now I'm really curious to hear about what the future holds for treating this condition. What advancements are on the horizon?
Well, one area that's really exciting is regenerative medicine. We're seeing amazing progress with stem cell therapy and using growth factors to help nerves regenerate.
Well, stem cell therapy has been getting a lot of attention in human medicine. How is it being used for spinal cord injuries in animals?
Researchers are trying different types of stem cells and different ways to get them to the injured area of the spinal cord.
Okay.
The goal is to basically encourage new nerve cells to grow and repair the damage.
So almost like using those stem cells as tiny little repair crews.
Yeah.
To rebuild the spinal cord.
Exactly. And it's still early days, but the research in animals has been pretty promising so far.
I've heard about some really encouraging results.
Yeah, some studies are showing improvements in motor function, sensory perception, even bladder and bowel control in some cases.
That's remarkable.
It is.
Yeah.
And then there's also research into growth factors.
Now, what are growth factors exactly?
They're naturally occurring proteins that help stimulate cell growth and repair.
I see.
So the idea is if we can deliver these growth factors to the spinal cord, we can sort of boost the natural healing process.
Give a little extra help.
Right. And there's evidence that some growth factors can actually protect nerve cells from further damage and even help new connections form.
So it sounds like regenerative medicine has a lot of potential for really changing how we treat spinal cord injuries, including haematomyelia.
Absolutely. It's a field that's moving really fast, and I think we're going to see some big breakthroughs in the coming years.
Now, besides regenerative medicine, are there any other advancements you're particularly excited about?
Another area that's evolving rapidly is neuroprosthetics.
Neuroprosthetics. That sounds pretty futuristic.
It is, kind of. It basically involves using electronic devices to bypass the damaged parts of the nervous system.
So sort of bridging the gap to restore function.
Exactly. For example, for animals with paralysis, researchers are working on devices that can directly stimulate the muscles so they can move again.
That's amazing. Are there any neuroprosthetics specifically designed for animals?
Yeah, there are. There's actually research being done on devices to help restore bladder control in animals with spinal cord injuries.
Wow, that would be huge for both the animals and their owners.
It would make a huge difference in their quality of life. And we're also seeing progress with brain-computer interfaces.
Brain-computer interfaces.
Yeah. It sounds like science fiction, but basically it could allow animals with severe spinal cord injuries to control things like assistive devices with their minds.
That's incredible.
It really is. The field of veterinary neurology is just exploding with new ideas and new possibilities. It's a really exciting time to be involved.
Well, this has been an absolutely fascinating deep dive. I've learned so much about haematomyelia, and I'm leaving feeling really hopeful about what the future holds for these patients. Thanks so much for sharing your expertise with us today.
It's been my pleasure. It's great to see so much interest in this important topic.
And everyone listening, keep those minds inspired, hearts light, and tails wagging. From Vet NeuroJar.